Welcome to the Resource Allocation Decision Tool, help video number 3. My name is Terry Haynes. This video focuses on how confident we can be in our judgment of effectiveness. The Resource Allocation Decision Tool asks you to rate the effectiveness of each option that you are considering. For each option, it also asks you to rate how confident you are that your judgment of effectiveness is correct. It asks you to say whether you are very certain, somewhat certain, or uncertain. When considering a field of research, you might decide that if an intervention's effect point estimate lies somewhere within this zone, that you might rate it as being somewhat effective, and that if it lies in this zone, the green zone, that it's highly effective. If you consider two different options, and one of them has an effect estimate that falls here and there, then you have seen that they've fallen within the somewhat effective zone, though very close to the null value of 0. As we mentioned in a previous help video, if the 95% confidence intervals lie completely to the left or completely to the right of that null value, you have a statistically significant finding. If you do not have that, which is the case for both of these interventions, then it's safer to assume, however, that the intervention has no effect until further research is conducted that allows a significant finding, one way or the other, to be made. Whether you are very certain or only somewhat certain in this classification of effectiveness will depend on the width of the confidence intervals. For the first intervention, the confidence intervals are quite narrow and close to the null value, so you are more certain that this intervention is not effective compared to the second intervention, which has quite wide confidence intervals. Noting, however, that these confidence intervals indicate potential for harm as well as potential for being somewhat or highly effective. If we consider two different interventions, both of them with point estimates in the highly effective zone, the principle is still similar. Being highly effective with very narrow confidence intervals means that you might be very certain that your classification of effectiveness is correct, whereas with very wide confidence intervals, as for the second intervention, you're much less certain that the intervention might be highly effective. This is because the 95% confidence intervals extends well into the somewhat effective zone. So you may only be somewhat confident that your classification of this second intervention as being highly effective is correct. Another factor that you should consider is the quality of the individual studies that the effect estimates were drawn from. There are many checklists available that identify factors that indicate a risk of bias in the results of a study that has been presented. The Pedro scale is one such checklist. There are often many items that are common across these checklists. For example, concealment of the random allocation sequence from study investigators and recruiters is a common factor that is identified in these checklists. However, sometimes there are important factors not included in these checklists that may be relevant to your particular field. The third factor you should consider is the appropriateness of meta-analyses. If you are fortunate enough to have found a systematic review and a meta-analysis that addresses the research question that you are considering, then you should also consider the appropriateness of a meta-analysis that has been presented. Here we have a meta-analysis of two studies where the interventions have sought to reduce depression in adults. We could call this meta-analysis a synthesis of studies of non-pharmacological interventions, because we have here group therapy and individual therapy. These therapies appear to be quite different, and group therapy in its own study was found to be not effective, whereas the individual therapy study was found to be effective in managing the symptoms of depression. However, when you merge the results of these two studies together, you have a result where there is not a significant difference between the intervention pooled and the control condition. So, does this result tell us that non-pharmacological interventions have no effect on the symptoms of depression? Well, it seems to be a bit of a spurious finding, because the individual therapy was able to find this result on its own. Now, of course, this could have just been a chance finding from an individual study, but it appears that the effect estimate of the individual therapy has been pulled down by the effect of the group therapy intervention. So, was it really fair on the individual therapy intervention to pool it with the group therapy? Even if both of the studies had examined group therapy, there could be important differences in how that group therapy is delivered, where it is delivered, who it is delivered to, that can lead to important differences in how effective the intervention is. So, when examining meta-analysis results, you should always consider, just because a meta-analysis can be done, should this particular meta-analysis have been done? It may be safer to examine the results of individual studies if you feel that the meta-analysis pulled together studies that shouldn't have been pulled together. When making your rating of your level of certainty that your judgment of effectiveness is correct, it is somewhat easier to examine and make the rating of uncertainty if there is an absence of evidence, or there's only very poorly designed studies or low-level design studies that have been used to generate the point estimate of effect. It is more difficult to separate out being somewhat certain from being very certain. To be very certain, you would want to be sure that the confidence intervals were surrounding quite tightly the rating of effectiveness that you made, and that there are few sources of potential bias in the studies that have been used to generate the point estimate of effect, or if a meta-analysis has been conducted, then that meta-analysis was conducted appropriately.